Welcome back, everyone. It is Stroke Awareness Month, and through the Fast and Faith Initiative, the American Heart Association is partnering with churches and faith leaders to make sure they're educating congregations about the warning signs of a stroke and the importance of immediate action. Every second counts. Joining us now with more is registered nurse Adrienne Grant, who is also the Health and Wellness Program Director for the Brookland Foundation at Brookland Baptist Church, and Dr. Danny Westerkamp, the Associate Medical Director at Encompass Health. Thank you so much for being here.
Thank you for having us.
So Fast and Faith Initiative is a catchy name, but FAST is important because it means something. What does the acronym stand for when it comes to strokes?
So with FAST, I can give you an example. My husband had a stroke several years ago, and he woke up and he just got up and he said, I can't get up, I can't stand up, I can't stand up. He kept falling on the bed. So when I got him up and sat him down, and the first thing I did was look at his face. So F for face. And I saw some drooping on one side. Then I said, okay, can you speak? I said, tell me what's going on. His speech was slurred. Raise your arm. He could raise one arm and couldn't raise the other. So those were all telling me, these are signs he's in the midst of having a stroke. Let's go ahead and get somebody there, get some help for him.
Yeah, and we have the acronyms right there on the screen: face drooping, arm weakness, speech difficulty, and T, time to call 911. Dr. Westerkamp, why does every moment count when it comes to making sure you are noticing the signs of someone having a stroke?
Well, time is critical in terms of treatment for the stroke. The quicker you get to the hospital, the more options we have to treat the stroke. We have clot busters, we have thrombectomies that we can use to reverse the effects of the stroke, but you have to get there in time, and that is critical to get there early.
And then I know it's easy to look at someone else and point out those signs, but what if you are experiencing some of those symptoms yourself? What would you encourage people to do?
Seek help immediately. I can give you another example. I have a young lady a friend of mine who had a coworker who started having just terrible headaches, and blood pressure was elevated. Everyone in her office tried to get her to go to the emergency room. She didn't want to go. She wanted to go home. So instead of heeding those signs that she was feeling, the headaches, and when someone says, I'm having the worst headache I've ever felt, then that's a really good sign that your blood pressure is way too high. You need to seek some assistance. Unfortunately, she decided to go home and lay down. Her husband got home maybe 2 hours later and found her unresponsive. He was able to look back on the door cam and see where by the time she got home, she already had some facial drooping. So she was in the midst of having that stroke, and instead of paying attention to those signs, like most people, a lot of people that we even encounter at our church well, I'm just going to go home and rest, and we're encouraging to know, pay attention to your body. It's trying to tell you something. So get some help, call your doctor, go to the emergency room, just get checked out. It may not be what you think it is. They may let you go. It's unfortunate you may have to stay there for a little while, but it's better to be safe than sorry.
Really good point, and thank you for sharing those examples with us. I want to talk about the initiative that you're having with the local churches across the area and the importance of that. Dr. Westerkamp, tell us about this initiative specifically with Brookland Baptist.
Sure. So we got together, Encompass Health Rehab Hospital, along with the American Heart Association, and decided since we're in the stroke belt, we need to make effort to educate people on how to take care of themselves if they have a stroke, how to get to the hospital in time, and to just get a better education about what's going on with stroke. We decided to join forces with the churches because we're also in the Bible Belt, and we have a great community of churches and community leaders with churches to get the word out about stroke. And so we started that, and of course, with Adrienne's help and people like her, we've been able to reach a lot of people and educate them on stroke.
You use the term stroke belt. I never heard that before. What does that mean?
So we're in the middle. Columbia's in the middle of the stroke belt. It's all along the southeast. We have a higher incidence of stroke here than anywhere in the country, and Columbia's right in the middle. And so it's really important to educate our population on the effects of stroke, how to prevent strokes, and then how to treat them when they have them.
Anything in particular causes strokes?
Well, there's a number of risk factors. High blood pressure is certainly one of them, and we are checking blood pressures at the churches to make sure that people are getting their blood pressure checked. But you also have cholesterol levels that you have to check. People with diabetes have high risk of stroke. People that smoke. So those are all things that can be treated and fixed and hopefully prevent the stroke.
That's really good. So I was going to ask about preventative measures, but just taking care of your body can help you do that. And then talk about the specifics of what happens at Brookland Baptist Church with this initiative, Adrian.
So we pretty much do things on an ongoing basis. We provide a health fair every year. We do a big health fair in March of every year. But even beyond that, we offer services at each of the services that go on at the church. So we have a nurse. We're fortunate enough to have enough nurses that we have a nurse that's on duty. So anyone who wants to get their blood pressure checked while they're there, or if they're having any kind of health issue, they can come to our health room, and we will certainly do a quick assessment on them. You know, we kind of have a first line into 911 when we need them to come. We have had, I have more examples than anything, we have had at one of our Women's Day programs, had a young lady who just got up and she grabbed her head, and I was like, what's the matter? She's like, I have the worst headache I've ever had in my life. And so it's like, okay, well, you were running a trip to the hospital. Yeah. And sure enough, she came back a couple of weeks, and she said the doctors told her that getting to the hospital in time saved her life.
Oh, wow. That's so good. That's so good to encourage people to do that, too, because a lot of people are busy. They don't want the burden. They're thinking about a bill or a wait time. Right. But your health is so much more important than that, right? And there's also a great free app out there through the American Heart Association, a free stroke education app, and people can just download that on their phone?
They can download the app. I actually downloaded it on my phone as well. Like I said, when my husband had his stroke, even though I'm a nurse, it was my husband, so it took me a minute, just a short minute, to kind of gather myself and say, okay, you know what to do. Pay attention to the signs and symptoms that he has. And I think about what happened the day before. You know, he said he had a headache, but he didn't say he had a bad headache.
Yeah.
And so I didn't pay attention because I was actually taking care of my mother at the time. But I would encourage everyone, pay attention to those signs and symptoms, especially in African American community.
Right.
If you're having headaches, if you know your blood pressure is not somewhere where it's really controlled, pay attention. Take your blood pressure, take your medicine on time, no matter what it. Some people say it just makes me feel bad. Well, feeling bad is better than you being here to tell me about it. Is better than me standing over you.
That's right. Thank you so much, Nurse Grant and Dr. Westerkamp, for coming on. We really appreciate all the tips and information. I learned a lot myself, too. So we want to make sure we pull up that acronym FAST to remind you that every moment counts when it comes to having a stroke. Face drooping, arm weakness, speech difficulty, and T stands for time to call 911 if you are experiencing any of the symptoms that we just mentioned before. We're going to take a quick break. Much more after this.